The Center for the Improvement of Human Functioning International presents this luncheon lecture. Today's topic, Oh My Aching Back, a mechanical and nutritional approach to managing back pain. Your presenter, Chad Krier, ND, DC.
Howdy. How y'all doing? Great. Well, he's not alone. There's a lot of people in the United States that suffer from back pain, so over 75 million people out there, and that number goes up every year. Laura just gave me an article yesterday in the newspaper that said it's one of the major causes for people missing work. So it's a big problem out there. We know there's 5 million people we think are probably partly disabled, can't do their work, can't sit, can't interact, can't do activities of daily living because of low back pain. 2 million can't really work at all. So it's a big problem. 8 out of 10, 80% of people at some time in their life will develop back pain, especially low back pain, and that includes sciatica as a part of that syndrome. Well, when we look at the back, we're largely talking today about the low back, and that includes the sacrum area and then all of your vertebrae, 5, 4, 3, 2, and 1, the lumbar vertebrae. And we're going to kind of focus on these areas. We've got your bones here, your lumbar vertebrae, and the discs in between. We're going to focus on those little guys and what they can do when they go out of place and all the problems that they can cause. When we look here, we've got 2 bones here. Those are your lumbar vertebrae, and then in the middle of those bones is a cushion. And so a lot of the times with back pain, when this cushion wears out or pushes backwards, it causes problems, because back here is where your spinal cord is, and then coming out through this area is where your nerve roots are. So when you have a problem in the disc or in the joints in this area, it can put pressure on the nerves, and that can create a lot of problems. What we're really going to look at in more detail is this little area right in here. That's what I call the water balloon of the disc. And it's that water balloon that's kind of like a jelly-filled area or a fluid-filled area. And that can move back, it can move forward, it can squeeze out, it can create all kinds of problems. And so if we can learn to work on keeping that little jelly area happy, the back can be happy. Well, back pain's complicated because low back pain, anything that tells your nerve, gives your nervous system a signal that there's some sort of irritation, can tell your brain that there's pain. So we can't say that there's just one cause for back pain. There's many, many, many different causes that can trigger low back pain. Many causes that can trigger the same pattern of low back pain. We're going to just look at muscular. Muscular, you can have a strain. Say you're out there lifting a heavy load of something and you tear a little muscle in your back. That can create back pain. Trigger points. If you repetitively do a motion over and over time your muscles can get tight. Once your muscles get tight, they may not get good oxygen flow to them. When you don't get good oxygen flow to your muscles, you can build up lactic acid in the muscles and in little areas of the muscle. And that creates a trigger point. So and those little trigger points are just areas of low oxygen in the muscle, and those can refer pain. Spasm. A lot of the times if you go out and overdo it, or you have an injury or a fracture, something of that sort, you can get looseness in your low back. You can get hypermobility in your low back. Your muscles go into protective mode. They go into spasm and lock down. It's really a protective thing, but then when you go and try to move, that spasm is pulling you back and forth, and it really can hurt. Hyper or hypotonic muscles. Hyper means what? Too much of something, a lot of something. So in this case, hyper is too much tension in the back muscles or in the ligaments. Hypo, too little, not enough, lack of tension. So let's say we sit at our desk all day and we're always bent this way looking on the computer or something. These muscles are going to get tight because we're bent this way. So they're going to be hyper. The muscles over here can become hypo. So we create an imbalance. Too much tension on one side, not enough tension on the other side. Well, that's muscles. You can have problems with your muscles, then you can have problems with ligaments. So you can sprain your ligaments. Again, usually if you have an injury to your back, you're going to have a ligament and a muscle involvement at the same time. So heavy lifting again, overuse, repetitive trauma, all those things can hurt the ligaments. You can get buckling of the ligaments. Sometimes if we chronically are bent in one position or stretched in one position for too long, our ligaments can buckle. When those ligaments buckle, then they're like a space-occupying lesion, basically. They take up space that they shouldn't take up, and they can put pressure on nerves. So buckling ligaments is another problem. The biggie that we're going to kind of look at today is poor sitting posture. When you have chronic poor sitting posture, poor standing posture, poor walking posture, poor posture period, then that can put stress where stress shouldn't be, and that can lead to problems. So if we're chronically sitting at our desk, bent over, these back muscles get a stretch. That's hypotonic. So those back muscles get stretched. We don't want to be bent like this, so our righting mechanisms of our body will try to pull us back. But if we chronically do this, our muscles get stretched, our ligaments tighten. As our ligaments tighten, that can put pressure on our spinal nerves, and that creates problems. So we're going to look at how to work on posture to try to help alleviate back problems. Well, here's some of the different muscles of the back. You can just see that the back has so many different muscles, and each of these muscles performs a different job. The back also has so many different ligaments, and each of those ligaments performs a different job. It can be kind of complicated trying to track down which muscle is involved in a low back pattern, which ligament is possibly involved, and they're deep. You can see here's a layer, here's a layer, here's a layer, here's a layer. There's about 5 or 6 layers deep of muscles in your back. So any one of those layers can be affected. Joints. Joints are the ones that get a lot of the attention, and when we think of pain, we think of joints a lot of the time. When you're looking at the back, there's several different joints that are involved. We have the bone and the disc. That can be considered a joint. And then you've got joints that set behind that disc where the bones rest on top of each other. And those are called facets. So a lot of the time back pain can be as simple as having something called facet syndrome. That's where the little joints that are on the very back of the spine get inflamed and irritated, and that can set up big pain patterns. Osteoarthritis is where you actually start having some degeneration of your bone. When you get degeneration, you start to lose cushion. When you lose cushion, bone rubs on bone. It can start to create pain. Friction equals heat equals inflammation equals pain. Bone problems. Again, osteoarthritis could be considered a bone problem as well as a joint problem. You can get fractures in the spine. Bone infections, rare, but if you have a fracture of some sort, often that can lead to an infection, and that infection can kind of sit there and linger, and sometimes it's hidden for several months, and then all of a sudden it rears itself. Tumors in the bone, all of those fun things can create problems. When we're looking at the vertebrae, we can see that these discs are not too bad. There's some cushion there. Then we look here, and there's really not much cushion between these two bones. The disc is pretty much gone, so that's a type of arthritis. It's degenerative disc disease where the disc has broken down. Now you've got bone on bone, not much cushion, and these nerve roots like to come out through these openings, these holes right there. Well, if you lose the cushion, this hole gets smaller. When that hole gets smaller, you're going to put more pressure on that nerve. And that nerve's coming out to go to some of the muscles in the back, in the legs, any of those areas. So as you lose cushion, more pressure on the nerves, more pain in the butt, the legs, and the back. Also, as you lose cushion, you get bone-on-bone friction. You start to develop new bones in places you probably don't want them, and that can put pressure on areas. Those are called osteophytes, when you get little bony growths that really don't belong there. Those little guys can go off and put pressure on things, and that can create irritation.
Is that the same as a spur?
Yeah, bone spur, osteophyte, yep. So we've looked at ligaments, bones, muscles, discs, joints, and then there's kind of the forgotten area of the body, and that's the fascia. So the fascia is just a blanket-like covering that covers each and every muscle individually, and then helps all of the muscles in the body connect through one big blanket. So if you have an injury to one area of the body, let's say you have an injury in the neck, well, the neck fascia is connected to the low back fascia, is connected to the knee fascia. All of that's connected. So if you have an injury in your neck, it can also set you up for back pain, butt pain, leg pain, all kinds of different things, because when you put a torque on the blanket up here, it's going to torque on the blanket down here. Vice versa, if you torque on the blanket in your back, it could torque on the blanket in your neck. So the body's all connected through big blanket-like coverings. And so that can get pretty complicated too. Well, the disc is where we're going to kind of focus a little bit. And again, the discs are just the soft cushions in between the bones. Now, the problem with the discs is that those little guys can do all kinds of different things. They can tear, they can bulge, they can rupture, they can degenerate. Any of those things is going to lead to pain, and we're going to kind of walk through that. The disc is made up of two layers. There's an outer layer of the disc that surrounds the jelly, kind of like a jelly donut. You got the outside, and then in the middle is jelly. So the outside of the donut is made up of all these layers of connective tissue. And then the inside is the nucleus, and it's just the spongy center that's largely water-based. I think of it as the water balloon. So when we're looking at, this is the bone on top, the bone on bottom, here's the disc in between, and this is what we're going to call the water balloon. Now this little guy can go out this way, he can squish down this way, and it can create lots of problems because back here is the spinal cord and the spinal nerves. You can get tears in this outer layer. This is called the annulus, and you can get tears in there, and once you get tears in this layer, then this little water balloon can kind of squeeze on out. It'd be like if you tore your donut in half, then the jelly would probably go out towards the side that you tore. Same thing with your back. So torn annulus, that's little tiny tears in the ligament, the outer covering of the disc. You can get tiny little tears in that outer covering, and because those are innervated by nerves, just little tiny tears can create problems. So you could go to your doctor and be in excruciating pain, and they could do an MRI and really not see anything because that's not going to show up well. It could be a tear in your annulus. You're not going to see any bulge or herniation on MRI with this, so that can be a problem. Now, bulging discs, those are the ones you will tend to see. This is where the little water balloon starts to push out on the outer covering. Now, the little water balloon's pushing out, but the outer covering is still intact. The donut's still intact, so the jelly's not squirting all over the place. It's still contained, but now it's putting pressure on things. So when we look, we can see that we've still got this outer lining intact, but the jelly has started to squeeze through. We've got some little micro tears in here, but no complete tears. And so the jelly here of the donut is starting to go backwards, and it's going to start putting pressure on the nerves. That's a bulge. Those are, if you have a bulge, they can be extremely painful, create sciatica, pain down the legs, numbness, tingling in the feet. It can act like a very severe problem, but if you have a bulge, that's very correctable and much better than a herniation. So a bulge is what you want to have if you're going to have extreme pain, because we can correct that. We can get that little jelly to come back in, and then over time, this connective tissue can heal, so it hasn't completely ruptured. This is, if we look from the top down, we can see what's going on. The little jelly's starting to leak back, but it's still contained. It hasn't broke through, but because it's leaking back, it's putting pressure on that nerve, and that nerve's going off somewhere, to your butt, to your legs, to your low back, and that's creating pain. Now, ruptured disc, that's the one that may have different names. They can say slipped, herniated, sequestered, ruptured, all those good things. That's basically where the outer lining, the donut's been ripped in half, and all the jelly's gone out. So that's more of an issue because now you don't have a strong connective tissue lining. Your donut's not strong anymore, and it's not holding the jelly in. That, over time, if we let that go too long, that can continuously keep pressure on the nerves. The nerves don't like pressure. They don't like to constantly have pressure on them. If you continuously keep pressure on the nerves, eventually you get nerve cell damage, eventually nerve cell death, and then we're in for some trouble. So that's a more serious problem, and that's something we want to try to get corrected right away. You don't want to play with that. The sequestered fragment is when that little jelly kind of breaks off, goes through that outer donut layer, breaks off and then it can travel. So that's a problem. You could have a disc that herniated in your low back, and that little fragment could travel up to your mid-back, could travel down even lower, but that can make it hard to figure out what's causing the pain, because those little guys can travel up and down your spine. So there's the jelly kind of squirting right on out, and then this is a sequestered fragment. Even though the problem was here, you may get more involvement from this nerve root down here, because this little guy is down here. Now, over time, the body in its wisdom may get rid of these. So we may be able to get rid of those sequestered fragments over time if our immune system kind of does its job and gets rid of those guys, but not all the time. A lot of the time that jelly stays there. The problem is that normally this jelly should be contained inside of the donut. When that jelly leaks out, your body may have an immune reaction to that jelly because it's almost like a foreign material in your body now. And if you have an immune reaction, then you're setting yourself up for all kinds of inflammation because your immune cells are constantly reacting to that jelly. They don't like jelly. Don't eat jelly. So when that happens, you can set yourself up for a lot of pain and inflammation in the low back. Again, this is a top-down view. We can see the jelly is squeezed out. It can push not only on the spinal cord, but also on the nerve roots. When it starts pushing on the spinal cord, that's when people really start noticing pain, weakness, loss of bowel function, loss of bladder function. That can be a serious sign if you feel like you're losing control in those areas. That's just another side view of how bad that can get. It's really pushing backwards on those nerves. Well, who has more problems with their low back? People who are in industry doing heavy manual labor, or people sitting at their desks all day? It's about equal. So we say that low back pain is about equal in people with sedentary occupations as it is in people doing heavy labor. So the heavy laborers generally have better backs than the people who sit all day. The people who sit all day tend to be the disc problems. The people who are doing heavy labor, they may have an acute problem, but oftentimes we can get those cleared up and then they can go back. So is this statement true or false? Back pain patients state that they have increased pain when they're sitting or when they come up from sitting. It's both. So most back pain patients, a good 80 to 86%, will say that their back pain is worse when they sit and when they come up from sitting. So one of the things that we think of with that is that, poor sitting posture. If your back pain's worse when you're sitting, maybe we need to figure out how you're sitting and come up with ways to make it not as painful. So a lot of the times when we sit down, now everybody's got lumbar supports in their chairs, but some of those lumbar supports are not adequate. A lot of those lumbar supports are wimpy, and some of them are too much for people. So lumbar supports can be very beneficial. When we're looking here, if we sit in a poor sitting posture, again, our spine goes into the flexed position. And if we have that little jelly donut in our spine, if you squeeze the front of the jelly, which way is it going to go? To the back. So if we squeeze the front of our jelly, it's going to go back. And what's back there? Nerves. So then it puts pressure on the nerves. The problem when we're in poor sitting posture over and over and over, our lumbar muscles, these back muscles, get relaxed because their job is to hold us like this. They like to pull us back. If we're bent like this, then these guys get relaxed and they forget how to do their job. They forget how to pull us back. So over time, sitting like that, our muscles quit working. Then our ligaments have to take on that weight-bearing job. So the ligaments take on the job of the muscles, and the ligaments aren't made to do that. And so that can set us up for a lot of problems. So let's see what happens if we get too much stretch on our ligaments, because too much stretch on the ligaments over time, that's going to weaken the ligaments too, and that's going to create lots of problems. If you take your finger and hold it in the air and just think about how it feels just holding it just like this. Okay? Now take it and bend it just like this, as far forward as you can, fully flexed. How does that feel? Better or worse? Okay? Now take it and bend it all the way back this way. Okay? So if your finger's like this, was that the least painful? That didn't trigger any pain. So when we take our finger and put it in a fully stretched position one way or the other way, that creates pain. Our body doesn't like to be in fully stretched position. And if you can imagine, if you keep your back muscles in fully stretched position for hours and hours on end during the day, if you have a sedentary job, over time that creates lots of stress on the ligaments, on the muscles, and that triggers inflammation and pain in the low back. So for those of us who if you don't have sedentary job, then that may not be quite as bad of an issue. Well, we're going to look at some of the factors, predisposing factors that can lead towards low back pain. So when we're looking, one of the biggies that we're going to talk about today is loss of extension in the low back. And this is probably 80%, but 20% of you, this is not the cause, so extension may not be for you. But a lot of people, loss of extension is the cause. And that's when you lose this ability to bend backwards. Probably about 86% of patients with low back pain have lost that ability. They've lost their extension range of motion. They can tend to bend forward pretty fine, but they lose that extension range of motion. Why would they lose that extension range of motion? The big cause is just generalized poor posture, no lordosis in your low back, no curvature in your low back, chronic setting postures that keep us bent forward. Guess two of the occupations that have some of the worst low back pain. Computer, dentists. Dentists have some of the worst back pain that I've ever seen, and it can be hard to get rid of because they've been stooped for so long, bent over in that forward position. And surgeons bent over on those tables. They have some of the worst low back pain that you can find because they're always in that stooped posture, and they're like this, and then they lose their extension range of motion. So when you're chronically stooped like this, what happens to your disc? It likes to go backwards. So they have chronic disc bulges, herniations, all kinds of problems. So the less flexion during your day, or if you're going to flex, you need to follow it with extension. But the less flexion during the day, the better. So, when we eat, when we drive, desk work, computer work, watching TV, all those things we're generally sitting. And unless we're really concentrating on keeping that spinal curvature, it can be a big issue. How many of you took music class? What did the teacher always do? Yeah, sitting up straight. Because it's not normal for us to want to sit up straight. Our muscles are kind of lazy. We like to just kind of lose that control. So if nobody's there reminding us, our spine's tendency is to flex forward. So the bottom line is, for most people, except for Jerry, we want to do more extension. Okay, and less flexion. So when you have those predisposing factors, to me the big predisposing factors that our body is constantly in flexion, it doesn't take much to set off a cascade of events. If you've been, as kids, how did we learn in classrooms? Generally sitting in desks and kind of sometimes lean your elbows on the front of the desk, kind of bent forward. Then if you go on to junior high, high school, generally learning in desks. Go to college, you're generally sitting in desks. Then how do you study? Do you study like this with your book at eye level? Kind of study like this. Or if you're tired, go to the library and sleep like this. So we're constantly in flexed posture throughout our lifetime. That flexed posture allows that disc to go backwards, weakens those ligaments, weakens those muscles. Then it doesn't take much. You get the people, they come in, they picked something off the floor, and that's what did it. They just shouldn't have picked that pencil up off the floor, because that's what caused everything. Is that really what caused it? Was it the 20 years of the flexed posture, and then all of a sudden it just took one event that really pushed it further backwards? Boom, low back pain. So any and all movements, I say picking up the pencil, lifting and flexion, all those things. If you've had a lifespan where you've been stooped or where you've been in flexion for long periods of time, it just takes one small trigger to initiate that back pain. Any small trigger can cause that disc to finally go back and create problems. So the ideal situation is to try to keep our spine in lordosis, to keep our back in extension, and to try to stay out of flexion. So we want to try to train our body to maintain that lordosis, and there's lots of different things you can do. You can roll up towels that are thick. You can roll up pillows. You can buy the lumbar rolls. And you just put them in the small of your back until you feel your chest come up. If your chest is still sinking down, then you don't have enough. You need to put enough in until you feel your chest finally come up. And that's for setting. You can do that at home, do it when you're working, do it when you're driving the car, any of those things. Now, if you're into lifting weights and all those things, then over the last 10 years, they've really focused on the core muscles, keeping those core muscles in extension, basically, when you do exercises. And now, all these new exercises are great because now they're focusing on those core muscles. And if kids can learn that early on, we won't have the incidence of low back pain and missed work. We can miss work because we're depressed instead or something. So we want to work on things that'll keep us in lordosis. We can do extension exercises, we can do low impact flexion exercises, and flexibility programs, and we're going to go through those. Now, if you have any radiating pain down your butt, down your legs, we don't always know the cause of that until we look into that pretty closely. You may not want to do some of the things we're going to try to do today. Can disc bulges be corrected? What did we say? Yeah, so we have to just figure out where those discs are bulging and then try to get that jelly donut, get the jelly to go back into place. So again, lumbar supports. I tell people start small and build up, so don't get a big bulky one at first. You might get a smaller one if you want to do a lumbar support. And this gradually build up until you find one where your chest is finally up. But you might want to do that over time, gradually let your ligaments and muscles readjust. So don't go out and find the biggest lumbar support you can all at once. Start small, give your body time to adjust to it. Okay, we're going to go through some pictures and then we're going to go through some exercises. And we're going to try to figure out which is correct in these pictures. So remember, we're trying to keep our body in lordosis, keep our spine in extension. We're not trying to flex most of the time. Yeah, so when lordosis is this curvature in the small of your back, should be like this here. So you should have a curve in the small of your back. Shouldn't be straight and shouldn't be bent like this. So you should have kind of a nice curve in the small of your back. That's lordosis. So it's an extension posture. Just like this. An extension posture is lordotic. Okay, so picking things up off the floor, is this good or bad? Yes or no? Okay, no. What don't we like about this? She's not bending her knees. Is her spine in lordosis? Not really there. Now this next picture is not that great, but she's at least bending her knees. Okay, so now she's bent her knees. What I'd like her to do is keep her spine more in lordosis when she does that too. So anytime you can keep your spine in lordosis, you decrease the risk of pushing that jelly donut backwards. So on this picture, where's she pushing her jelly donut? Out the back. Okay. How about working at the counter? Is that a good one? Okay, so she's taking some load off of her spine by elevating her knee. So if you do a lot of work at counters, or if you're cooking or any of those types of things, you can take a lot of pressure off your spine just by having a little footrest to elevate your knee, and that can help keep you in lordosis. You want counters that are high and not nice and not low, so you don't have to bend over. How about there? Nope, no good. How about lounging around? How's that? I mean, that's not too bad there, but she's kind of looks a little comfortable, doesn't she? Now, how about that one? That's going to be better because now she's got her knees are flexed. She's taken pressure off of these front muscles that can pull on your discs as well. So that's why they, 20 years ago they started telling people quit doing sit-ups with your legs straight. You got to bend your knees to take pressure off these front muscles that irritate your back. So she's got a cushion under her knee. You can't see it, but she's actually got a small cushion under the small of her back. And then she's kind of got some cushioning in her neck. So the neck should be in lordosis, and the low back should be in lordosis. The mid back should not be. So the neck should have this same curve. It should have this lordotic curve just like the back. So it should be in a kind of an extension posture too. Okay, how about sideline? How's that one look? Not too great. How about that one? So much better. She's got it to where her pelvis is not off balance because she put a pillow in between her knees. With no pillow in between your knees, your pelvis can shift and become off balance. That can create pain in the low back. She's got enough pillows to where her head is not bent one way or the other. Her head is kind of straight on. So that can be a good position if you're sidelined. Put a pillow between your knees. Have enough elevation under your head to where your head's not bent to one side or the other. How about sitting there? Yeah, she's got a little kind of cushion in the small of her back that's keeping her chest expanded. She's got lordosis in her low back that way. She's got her knees to where they're parallel to the floor. They're not drooped down, putting tension on the front. So that can be a good posture for sitting. What about that one? Not quite. Desk work. Is the jelly going forward or backward there? Backward jelly. Okay, how about on this one? It's better. She's found her, can't see it up there, but she found her a little lumbar cushion. It's keeping her back more straight. Okay, we're going to look at doing some simple exercises here that work on helping to prevent our discs from going backwards. The problem is a lot of us have been in flexion. Now we have to retrain our backs to go into extension. So we're going to work on some of these things. Some of these we can't do, but we'll do when we get to standing. So here, she's just laying on her tummy. And initially, if you have a hot disc, if it's a sudden onset of disc pain, a hot disc, the best thing you can do is just lay on your tummy flat. Because what happens, when we're standing up, gravity's pushing down this way, right? So it's compressing us this way. And when it's compressing this way and that disc's already hot, it's going to push it back even further. If you lay on your tummy, now which way is gravity pushing? It's pushing it down, so it's pushing that disc back into place. So when you have a hot disc, the best thing you can do is lie on your tummy. A lot of people think the best sleeping posture is on your back, but that's not true if you have a hot disc. Back posture is good for your neck. Tummy line's good for your discs. So just lying flat can be good. But for these exercises, we just start out flat, and then we want to come up into extension on our elbows. And if you have a hot disc, you may not be able to do that right away. You may just have to lie flat for an hour, 2 hours, let that disc come down. Then you may be able to come up into extension over time. And if your disc is really hot, I'd say just hold that extension for as long as you can. You can hold it for 5 minutes, 10 minutes, 20 minutes, kind of let the jelly try to slide back forward. If it's not a hot disc and you're just trying to do exercises, then you can come up, hold it for 30 seconds or so, relax, and then repeat that 10 times just to train your muscles and your ligaments to start working better. If it's a hot disc, though, you want to hold that posture for a really long time. You can do it on either surface. Hard is fine. Yep. You can do it on the bed. Yep. This one is where she's kind of extending even more now, so she's going into more extreme extension. This again, 10 to 15 seconds. Repeat that 10 or 12 times. If you're working on getting your disc slowly to come forward in an acute situation, this may be something you perform on day 4 or 5. So you'd want to do a progression. If you have a real hot disc, you may be in this position for 2 or 3 days. Then after 2 or 3 days, if you feel like things are progressing, you go to this position. After 2 or 3 days, you may be able to get to that position. Your disc gradually comes forward over time.
So if you have a vertebrae problem, is that good for vertebrae in your upper and lower back?
It depends what kind of problem you have. If you have spinal stenosis, this may not be the best thing for you. Extension may not be the best thing. You may actually feel better in flexion. So that's a little bit different. If you have a facet irritation or a posterior joint problem, a back joint problem, then that may not be the best posture for you. You might want to do mild extensions and not extreme extensions. Then we can go to the standing extensions. If everybody wants to try those, you can stand up. And we're just stabilizing our pelvis. So when you have a hot disc, we don't want to do standing extension. Why is that? Because gravity's pushing down and that will push it further backwards. Once your disc is out of an acute situation, then you can go to doing the extensions. You can just put your hands on your hips and then extend backwards, nice and slow, and then come back to the midline. The problem is you don't want to come back and forward flex too much. You just want to go into extension. So go ahead and extend And we can hold that 1, 2 through 10 to about 10 seconds, and then come back forward. Then we can try it again and go back and then come forward. And over time, those would be good exercises if you've had a history of disc problems. Try to retrain your back. The next one I'm just going to glance over is we can do flexion, and we can do that standing as well. You just pull your knee up, one knee at a time, and then release it, and then pull your other knee up. And you can do it on the floor also. The problem if you do extension, that's what we want you to focus on, extension, extension, but over time, then what happens? These muscles get stretched, they get loose, they have problems. So eventually we add the flexion to it. But my rule is that you always follow any flexion exercise that you do with extension. Why? Does that make sense? If you're flexing, you're pushing the jelly backwards, so you want to extend afterwards to push the jelly forward. Okay? Okay, we're going to work on doing some flexibility exercises to try to Now, the whole point of doing these flexibility exercises is to get the ligaments loosened, to get the blood flow to the joints, to help bring fluids into the joints because our joints are made of fluids. And so that's what we want to do. We're going to do these flexion and extension exercises. And basically, you're going to put your hands on your hips just like this. Bring your elbows forward, like the Arnold Schwarzenegger pose here. And then tuck your chin down. Okay? And then you slowly rotate backwards. You bring your hands off your hips, extend your arms backwards, and look up. So there's not a whole lot of motion involved here. And then you do it again. You come forward, bring your elbows in front of you kind of together and look down. And then you go backwards and you look up. Then the goal is after you do those a while to start doing them a little quicker so that you pump fluids and blood into all those muscles and joints, promotes flexibility and all those good things. Those exercises are working on flexion and extension. So that's two motions of the spine that are important. And they're not extreme flexion and extension. You shouldn't be bending from the waist at all. So those two are working on flexion and extension. Then we're going to work on a third motion of the spine, which is rotation. On rotation, all we're going to do is turn our head as far as we can behind us, bring one arm to our shoulder, one arm to our opposite butt, and just swing like that. Then we're going to change it. One arm to the shoulder, one arm to the butt. And then eventually you just kind of start going a little quicker, trying to keep your pelvis facing forward, just rotating that low back. If it's painful, don't rotate very far, just slight rotations and arm movements. You can kind of just do this.
You want this shoulder high or what? Or not?
That's fine. Yep. Yeah, shoulder high. Yep. So you're kind of... And eventually, we just have you do that for 1 minute and try to feed the cells of the bones there. Then lastly, we do side bending. So your spine has about 5 motions. It's got flexion, it's got extension, it's got rotation to the right and the left, and then it's got lateral bending to the right and the left. So the last thing we do is lateral bending to the right and the left. And on this one, I go ahead and work your whole spine. You take your head to your shoulder first, and then you bend. And then you take your head to your shoulder, and then you bend. And then you take your head to your shoulder and bend. And then kind of just start going back and forth. And that helps pump blood flow to those muscles. So you have to do it slow at first and then build up to it. Those are spinal flexibility exercises that can help increase your range of motion in all planes in the low back. Flexion, extension, rotation, and lateral flexion. Okay, you guys can have a seat.
Does that help the upper back too?
Yeah, can help the neck and the upper back. So it really works the whole spine. We're going to briefly just touch on some of these things that you may see because you may hear about different therapies and wonder what they are out there. One of the biggies for low back pain is the McKenzie approach to low back pain. McKenzie was a New Zealand physiotherapist who kind of started looking into the discs and all the problems that discs could cause. And basically his whole theory was that loss of extension over time created problems in people. He had an accident. He had a patient come in who had a hot disc, and his secretaries or nurses, whatever, put the patient in a dark room and had him just lie on the table. Well, he never realized that the patient was in there. About an hour later, he walked in there, and poof, somebody was laying on the table. So he turned the light on, and he told them to stand up. He didn't really even know what they were doing there, and they stood up, and they said, "Oh, that's the best I felt in 2 years, Doc." So then he started putting something to that posture. And over time, he started putting people into extension postures and noticed that their pain was dramatically better when he'd put them in these extension postures. People would come in with sciatica, and you could work them into these particular extension postures, and their leg pain would go away, but their back pain would become excruciatingly painful. What was happening there, do you think? The jelly might have been, let's say you have pain down this leg, the jelly squeezing backwards and to this side. As you go into extension, the jelly's starting to come from outside to in, but then it's pushing more centrally. So as you take pressure off the outside, the leg pain was feeling better, but the jelly was still pushing on the central area, and so the back pain was becoming excruciating. So over time, it's a good sign if your back pain worsens as your leg pain lessens, because and people will get mad. We'll work on them for a few times, and they'll say, "Well, my back pain and my butt pain's gone, but now my back is horrible." And I'm excited because that means their pain is centralizing. That means that disc is starting to move from the outside to the inside, and within a few more days we can finally get that disc to move forward, and they shouldn't be in as much pain. There's other things out there. There's different chiropractic therapies. Cox therapy is one you may hear of. That's where they use a specific table, and on that table moves in different directions, and you can actually distract. You can push the table down and distract the spine. Hopefully when you distract the spine, you can create somewhat of a vacuum force so that the disc can be moved anteriorly. If you have a disc problem, that can be something that can be beneficial. So again, chiropractic, myofascial release, that's when you work on the blankets. So there's a lot of massage therapists out there, chiropractors, physical therapists who do myofascial release, and that's when they're working on the blanket covering the muscle to try to get that loosened up. Because if the blanket around the muscle is tight and you don't ever work on that, you just give muscle relaxants, the muscle may relax, but the blanket's not going to loosen up. So we've got to do things that loosen the blanket.
What is that exactly?
I'll show you a picture here. So basically this is an example of myofascial release where you would apply pressure to a specific muscle. In this case, you're taking the back muscle, and the back muscle is in a shortened position here. Then the patient brings their knee to their chest while you maintain pressure. And basically what you're doing is stretching the blanket as you apply pressure. So you're trying to get kinks out of the blanket, basically. A lot of chiropractors will do that, yeah. A massage therapist will do it. Physical therapists will do it. Yeah, osteopaths. There's a lot of people have learned myofascial. And they may have different ways of doing it, but it's basically the patient's involved in active movements while you're stretching the fascia on their body.
And you injure your back that way?
Injure your back doing this? Shouldn't be able to. No, not if they're doing it okay, unless they're getting crazy with you. Again, there's lots of different electrical therapies that are out there too. Those can be beneficial for help relieving pain control, help alleviating muscle spasm, those sorts of things. One thing that I really like is the diathermy unit. So if you find a chiropractor or a physical therapist or an osteopath, these kind of fell out of favor as new things came along, but these work great for bringing blood flow to muscles. So diathermy, just dia is through and thermy is heat. This is one of the deepest heats that we know of. It can actually penetrate 3 to 5 inches into the body, and it doesn't produce heat. It doesn't give you direct heat. It causes your cells to exercise. And so it can get those deep muscles to exercise that a lot of the time aren't getting exercise. It sends waves into those muscles. Those muscles increase their metabolism, and they produce their own heat. So that can be a good thing to use. No, TENS unit is really, to me, is not very therapeutic. It's basically like taking an aspirin. It's blocking nerve nerve pain, but it's not doing anything physiologically beneficial. So a TENS unit is basically just blocking nerve pain. It's kind of like taking a Tylenol without the stomach side effects. There's electrical machines that have benefit, like interferential, high volt, low volt. All those different things actually do something physiologically to help the muscles rebalance. We're going to look at something called contrast hydrotherapy that you can simply do at home. This is one of those things that helps to create blood flow to the muscles, tries to help pump blood to the muscles. What you do is take a hot towel and a cold towel. So you can get a hot water basin and a cold water basin. You put a thicker towel in the hot water basin, a smaller hand towel in the cold water basin. And what we're going to do is apply those towels to the low back. You apply the hot towel to the low back for 3 to 5 minutes. What you're doing with that is drawing blood flow into the area. So you're bringing nutrition to the joints, bringing nutrition to the bones, to the muscles. And then right after that, you put the cold towel on for 1 minute. What you're doing there is pushing the things away, pushing all the waste products away from those muscles. We repeat that 3 times so we create a pumping effect. We're doing hot, cold, hot, cold, hot, cold. You're bringing nutrition into the back, pumping it away, bringing it in, pumping it away. It can help wash out lactic acid that can signal pain receptors, and it can be a very good therapy. It's something you can do at home pretty easily.
How many times do you do that per day?
You can do it once or twice a day. At least once would be good.
So you just put the towels on top of, you take those towels off?
Yeah, you take those towels off and put hot ones on. Yep.
You rotate hot and cold?
Yep.
Put the cold right on top of the hot, or take the hot off?
You take the hot off. Yep.
Okay.
Yeah, you want to get skin contact with the hot. So yeah, first is hot. You take that hot off, then you go put the cold on. Then you take the cold off and put the hot on.
For how many minutes you say?
So 3 minutes of hot and 1 minute of cold, and you repeat that 3 times, so it'll equal about 10 or 12 minutes. Okay, we're going to look at some different nutrient therapies that may be beneficial. So we're kind of looking at this from a mechanical approach, from a nutritional approach, from a nutrient approach, all these different things. You have little chemicals in your body called endorphins and enkephalins. Endorphins are your natural painkillers that your body produces. We can try to help keep those endorphins around longer by taking different amino acids. So there's an amino acid called tyrosine that its claim to fame is that it helps with the thyroid and making stress chemicals, but it also can help make endorphins, natural painkillers. So that can be an alternative to some of the painkillers, trying to keep these endorphins, these painkillers, around longer. DL-phenylalanine, that's another thing that can help decrease the breakdown of endorphins in your body, help keep those natural painkillers in your body around longer. When you buy, if you decide to try some of that, the D form is actually the form that keeps the endorphins around longer. But a lot of the times it's hard to just find the D form. You might have to get the DL form, and it should probably do about the same thing. Glucosamine, who's heard of that before? That's kind of the most popular one out there. So glucosamine is just small little molecules that make up the connective tissue of our joints and our ligaments. So it's like small sugar molecules that help give us strength. Chondroitin sulfate is basically just bigger glucosamine molecules. So if glucosamine is just little tiny molecules, you put a chain of those together and then you have your chondroitin sulfate. So probably saving your money, just take the glucosamine and skip the chondroitin. May work okay to take both of them together, but we think when you take chondroitin, you're just going to break it down into glucosamine. Just take the glucosamine. MSM, that's giving your body organic sulfur. Sulfur is a mineral that is very beneficial for helping build connective tissue. People who are on a lot of medications tend to lose sulfur out of their joints. because their liver uses lots of sulfur to detoxify things. So as you're detoxifying things, you tend to pull sulfur from your joints. So a lot of the times it can be very beneficial to give people extra sulfur so that that sulfur not only goes for your liver, it also goes to your joints.
How many units can you take?
On the MSM, you can probably go up to about 3,000 milligrams.
3,000?
SAMe, that's just an activated form of a particular amino acid called methionine. This, again, can be very beneficial because it helps increase the lubrication of the joints. So not only the joint tissue itself, we think this actually increases the lubrication or the fluid levels in the joints. So SAMe is another one to think of.
Can you do both?
You can do both. You can do all these in combination. It shouldn't be a problem. There's another one. Everybody's probably heard of melatonin for sleep. But how many people know melatonin decreases swelling? So it's a natural anti-inflammatory. It's a natural painkiller. It's an analgesic. And it's a sleep aid. So if you have problems at night with pain, melatonin can be beneficial because it helps decrease all those problems. It can be a natural painkiller, decrease inflammation, decrease swelling, and help you sleep all at the same time. With that one, if you have pain, you might want to use something else during the day and take this only at night. You don't want to use that during the daytime.
Do you take other medicine like blood pressure pill and affect
The melatonin, no, probably not, but you probably, before you do any of that, talk to your doctor.
Okay.
There's also a lot of vitamins that can be pain relieving. We think of the B vitamins when we think of energy and when we think of the nervous system because of their profound effects on the nerves. B1, they've actually done studies on that where if you take high doses of thiamine or B1, it can help decrease nerve pain quite a bit, especially spinal pain. B3 is one, niacinamide, the amide form of niacin, the amide form of B3. They've used that in studies with osteoarthritis of the back, and it can be very beneficial. And the dosages are there that they've recommended. And then B6. Who's heard of B6 for carpal tunnel? B6 got pretty popular for carpal tunnel because it's good for decreasing swelling. So it can be a natural anti-inflammatory, but it's also good, helps when people are weaning off painkillers. If you're trying to come off of your painkillers, taking B6 can be beneficial. We think it's because of the serotonin pathway that B6 helps to promote. B12 is another good one, has good effects on the nerves. Giving injections of B12 has been shown to be helpful. When you have disc bulges, disc herniations, a lot of the times that can help alleviate the pain. Not 100% sure on the mechanism there, but it has shown to be beneficial. You may get away with just taking oral B vitamins too in high dosages. There's some natural anti-inflammatory herbs out there. All these guys, capsaicin is just a cream you can rub on. And capsaicin can be irritating. It's somewhat irritating as you put it on at first, but over time it depletes something called substance P, which is an inflammatory pain chemical that triggers your nerve cells and tells them to have pain. Over time, using this capsaicin cream depletes that neurochemical so it can help decrease your pain patterns. Curcumin, turmeric, Indian food. Turmeric is a nice anti-inflammatory. It knocks out several of the different pain pathways in the body, several of the different inflammatory pathways in the body. So that can be very beneficial. Devil's claw, that's been shown in studies to be very beneficial for osteoarthritis of the spine. So it's particular for arthritis in the spine. And then ginger, again, is another good anti-inflammatory.
Where do you buy that devil's claw?
You can find that at health food stores. Yep. Yeah, most of those herbs you can find at different health food stores. You can find we have a lot of them upstairs here. Homeopathy, there's two specific homeopathic remedies that you might consider with low back pain. One is called ruta graviola, and ruta is when they're worse from movement. So if they're sitting still, they tend to be okay, but then they get up and move around and their movement gets worse. That can be a good indication to use that particular homeopathic remedy. Now, if there's the opposite one, it's called rustox. I call that the rusty gate remedy. That's when you're kind of squeaky as you first get up, or when you're sitting around, you're nice and squeaky. But as you move around over time, that squeakiness goes away. That's a good indication that you may benefit from rust tox. So give that one a try. We're going to kind of skip over fatty acids. Everybody take them. Now, one thing that we do here that's somewhat unique that not a lot of doctors do or know about is IV colchicine. And colchicine is a natural anti-inflammatory. Its claim to fame was that it was a gout medication. But you can actually use IV colchicine to decrease pain patterns for people with disc herniations. And it can be beneficial. Now, not everybody has a benefit from it. Probably about 6 to 7 out of 10 patients will respond. 3 to 4 of them out of those 10 won't. But it can be very beneficial and is something to consider. Okay, so bottom line, there's many causes of low back pain. It's always a good idea to have a thorough checkup to see what's triggering your back pain. But for the most part, we can say 86% of people have a loss of extension range of motion. Getting that extension range of motion back can be pretty beneficial. Okay, I think we got time for a few questions here. And they'll come around with the mics, and then we can ask.
Does smoking affect back pain?
Does smoking affect back pain? Well, probably. I mean, anything that decreases blood flow decreases nutrition to the joints, and it can definitely be a problem. So I'd say, yeah, it's not a beneficial thing. Who's got them? Okay, then you.
I've read that glucosamine hydrochloride was better than glucosamine sulfate. What do you think?
I like the sulfate form, but there's a lot of people using the hydrochloride form too, and I haven't read the studies on what the difference is between the two, but I generally like the sulfate form. Seems like that I get better luck when I put people on that form. Yeah. Well, I don't know. Glucosamine sulfate is the one I like to give. I like that one better, but there is glucosamine hydrochloride too.
How about the one that has everything?
Yeah, those are fine. You can do combinations too.
What is melatonin, and is it safe to take? And also, if you take all of these nutrients and vitamins, all of them together, is it going to be too hard for your liver to process?
Well, you might want to, talk with your doctor and see what you're on and things of that sort. But most of the time, you can combine MSM with glucosamine and chondroit and not be a big problem. You can add the B vitamins on top of that, and it's not a big problem. Melatonin was promoted as a sleep aid. It's a neurochemical. It's made from tryptophan and serotonin. Then you make melatonin. And so it's a natural chemical that's released from your pineal gland that regulates day-night cycles. So that was its claim to fame, was when people were getting jet lag, they could take some melatonin to help them reset their day-night cycles.
This is a synthetic form if you're taking it.
Well, yeah, everything out there is probably synthetic because it's all made in the laboratory. So, yeah. But it's bioidentical to what your body would make. So that's a better term.
Is it a hormone?
You could consider it a hormone.
Is there an alternative to spinal fusion?
An alternative to spinal fusion just kind of depends what you're getting the fusion for. They'll fuse your bones for a lot of different things. If you have severe disc degeneration, ruptured discs, and there may be alternatives. It just depends on how severe the ruptures are and where the fragments are wandering and what kind of nerve irritation you're having and nerve damage. If you're having a lot of severe nerve damage and it's gone on a while, that may be your only option. But yeah, there's definitely alternatives out there. Okay, I think one more, and then we're going to do the drawing here.
At what point does osteopenia or osteoporosis come into play as far as your lower back?
Well, to me, osteopenia, osteoporosis is a form of osteoarthritis because it's a weakening of your bones. Anytime you have a weakening of your bones, you're setting yourself up for having problems in your joints. And so, it's kind of the same thing. When you have weakness in your bones, I would say it's not a good thing. So the more you can strengthen your bones, the better off you'll be, the less likely you will be to have disc degeneration, the less likely you'll be to have osteoarthritis. So those two kind of go hand in hand.
The preceding program was presented by the Center for the Improvement of Human Functioning International in the Bright Spot for Health Lunch and Lecture Series. To inquire about additional health-related information available on DVD, audio CD, VHS, or audio cassette, simply call 316-682-3100 or drop by 3100 North Hillside in Wichita, Kansas. To discover more about the center and what we have to offer, be sure and visit us on the web at www.brightspot.org.